Hello, everyone, and thank you for your time. The purpose of this study was to compare perceptions between students with and without administrative leadership responsibilities within a pro bono student-run clinic. Student perceptions were addressed related to educational benefit and leadership based on whether they hold a leadership position or not. Our clinic is set up 2 times a week, receiving referrals from community providers. We function as a pro bono student-run clinic and do not charge for services. During year 1, which relates to cohort 1, there's a very minimal to no involvement in the student-run clinic. Involvement progresses as the program progresses. During year 2, there's usually a 2-to-1 student-to-patient ratio due to the decreased clinical experience. During year 3, there is a 1-to-1 ratio. Leadership roles in the clinic consist of scheduling, checking voicemails, making reminder phone calls, patient check-in, and daily clinic maintenance. Many DPT programs have incorporated pro bono clinics into their curriculum, with a portion of students upholding leadership roles. Previous studies support that students' perceptions of involvement in pro bono clinics are positive. However, less is known about the effects of leadership on students' perceptions. Our hypothesis is that students with leadership positions would perceive a higher benefit. Annual Qualtrics surveys were distributed among each cohort, first, second, and third year, enrolled in one DPT curriculum over a consecutive 3-year period ranging from 2018 to 2020. The students responded using a Likert scale. The scale was coded using a range from -2 to 2, with -2 being strongly disagree, 0 being neutral, and 2 being strongly agree. The data was then analyzed from 2 specific questions related to leadership and educational benefit that were a part of a larger survey of other perception-based questions related to student-run clinic involvement. The questions were, my involvement in student-run clinic enhanced my professional leadership skills, and the second question, overall, my involvement in student-run clinic enhanced my educational experience. Data was analyzed using the Manu-Whitney test to compare student leaders versus student non-leaders' perceptions of leadership and educational benefit, and a sub-analysis was performed to determine differences based on a student year in program with alpha of 0.05 for all analysis.
Moving on to the results section, we have 2 graphs as shown. The first graph represents leadership benefits throughout the 3 different years, 2018, 2019, and 2020. Significant data with a p-value of less than 0.05 is indicated with a red asterisk as shown in each graph. Figure 1 is the means for the leadership perception benefits for all 3 surveys years. We also split each year, 2018, 2019, and 2020, into each 3 cohorts, and we performed a sub-analysis for each cohort as listed. Cohort 3, which would be the 3rd year of the program, for leadership benefit perception had statistically significant differences between leaders and non-leaders for the 2018 and 2019 years. Cohort 2, for leadership benefit perception, had statistically significant differences as well for the 2020 year. As seen in Figure 2, there was only one area of statistical significance for educational benefit, and we also performed a cohort sub-analysis for this year, and cohort 3 for educational benefit perception had statistically significant differences between leaders and non-leaders for 2018 only.
For our discussion, our data shows changes in perception between leaders and non-leaders. Students seem to have the most significant perceptions of benefit during the first year of SRC 2018, most likely due to the novelty and added educational component, as well as the opportunity for more patient interactions compared to previous curriculum. Though we did not run statistics, we saw through our data breakdown that 3rd years seem to have the higher perceptions of benefit for each survey year, which may be due to decreased course load, improved understanding of how working in the SRC carries over into clinical practice, and increased comfort working with patient populations in the 3rd year of a DPT program. Overall, the survey year also influenced the overall student perceptions, potentially due to changes in patient participation in that specific year and other extrinsic factors unique to a given year, which may influence student perceptions of educational and leadership ability due to variable patient influx. Based on our analysis, certain changes made to an SRC curriculum could improve overall student perceptions, such as increasing student participation in the 3rd year and decreasing the amount of mandatory clinic time during the first and second year of a DPT program, where heavier coursework and other factors, such as decreased overall knowledge and patient experience, may decrease students' perceptions of benefit. Another suggestion is to more evenly distribute responsibilities across leadership positions within the SRC Leader Board. This would allow more opportunity for leadership experience throughout the board and take some of the extraneous pressure from the higher ranking members of the Leader Board. Finally, observation of overall student hours in clinic should be made to determine what the optimal amount of mandatory hours in clinic would be in order to prevent burnout and improve student perceptions of benefit. There were limitations that potentially had some effect in the study conducted. The survey itself is voluntary and distributed to the students via email with no incentive to complete. This causes an inconsistent response rate, which may have some effect on the outcomes. There was also no participation in the first year cohort during the initial year of the SRC, which would decrease those students' perceptions of benefit as they were unable to experience the clinic or lead to those students not responding to the survey. There were also several variables such as inconsistent patient participation throughout the years, variable student to patient ratio, and different professor supervisors depending on the year and the day of the clinic. This could lead to a difference in opportunity for learning experiences and patient interaction between cohorts and between the years of the SRC survey. Finally, the clinic itself can become a stressor during the academic year due to increased time demands on students, as the clinic is multiple days a week and requires work outside of clinic hours. This in turn could affect students' overall perceived benefits. You can contact our faculty advisor, Dr. Lysick, if you have any further questions. Thank you again for your time.